So I make it 16:30 or 18:30, and I think we're still missing a few people, aren't we? Is Councillor Tilbury here? Councillor Regan? Councillor Jones? I can see Councillor Tilbury. Anyway, I'll start the meeting, and hopefully they'll catch up with us. So welcome everybody. This is the Basingstoke and Dean Community Environment Partnerships Committee meeting on the 17th of March 2021. I've just got a few things to read out before we start. So I'm Councillor Gaskell, the Chair of Communities Environment Partnership Committee, and I would like to welcome everyone to the meeting, which is being held virtually and in accordance with the Council rules for virtual meetings, which reflect recent published government regulations. The meeting is being streamed live on YouTube and will also be available to view after the meeting is finished. Councillors who sit on this committee are identified by name on the screen, and I will introduce the officer's name before they address the committee. Councillors are reminded that although this meeting is being held remotely, they are regarded as being present in a meeting for the council, and they should observe the normal rules of behaviour under the Members' Code of Conduct and not allow members of their household to distract them during the course of the meeting. Can members ensure that the mobile phones are now switched off or are on silent? Members of the committee will turn on their video link during the meeting and keep their microphones muted unless they have been invited to speak by myself as the chair. Members are reminded that if they switch off their video link or move away from the camera, they will be treated as leaving the meeting and will not be able to take part in any vote taken on the item under discussion. Members can indicate their wish to speak by raising their hands or by using the electronic function, and should only speak when I, as chair, invite them to do so. The officers present will only switch their video link on during the item that they are presenting or where they wish to be invited to speak by me as chair. As chair, I will confirm the name of any visiting speakers at the appropriate time in the agenda who will address the committee by audio link. Councillors should declare that they are leaving the meeting and switch off their video link if they have a disclosable pecuniary interest or other personal interest in an item on the agenda. The councillors can switch on their video link when I call the next agenda item. Voting will be taken on a roll call, and I will confirm the recommendation proposed to the committee before the voting begins. Can each member indicate whether they are for or against the recommendation, or whether they wish to abstain? Hopefully we will not have any IT problems, but can I remind councillors that if their connection is lost, that they should immediately advise a democratic support officer and use their meeting link to access the meeting again. Thank you. So are we still missing councillors Regan and councillors Jones? So item 1 on the agenda.
Sorry, Chair, it could well be that they are struggling to get in because Councillor Jones just tried to telephone me, but I cut him off because I'm in the middle of a meeting. So I don't know if that's anything that Democratic Services can perhaps email them both the link again, if they wouldn't mind. Thanks.
Yes.
To confirm, sorry, Chair, we have actually emailed them the link. Excellent,
thank you. Okay, well, item 1 on the agenda is apologies for absence and substitutions. I don't see any substitutions, but we've got 2 people missing, so hopefully they'll join the meeting as we go along. Item 2, declarations of interest. Are there any declarations of interest? Councillor Fawkes.
Yes, thank you, Chair. Item 6, I'll just declare that I am a Two Saints board member And Two Saints provide homelessness services, but not, as far as I'm aware, to care leavers, particularly in Basingstoke. So it doesn't stop me participating. I just want people to know. Thank you.
Okay, thank you. That's noted. Item 3, urgent matters. Due to the lateness of the report, which was not published 5 clear working days before the meeting, I have agreed to take item 7 for the following reasons. The report was published late to give Planet Ice the opportunity to consider Council's response to their proposal. No response has been forthcoming, and we await feedback from Planet Ice on their proposals to repair the building. So we'll come back to that later in item 7 and address that issue. Are there any other urgent matters? Okay, item 4, minutes held on the 20th of January. Are the committee happy that the minutes of the meeting held on the 20th of January 2021 are accurate record? I'll take that as yes. Is that agreed? Okay, there was a couple of things which I just wanted to note, which we discussed. So the fireworks referral, I've asked to be updated, or I've asked for the committee to be updated before November. And we've all had an update on the Bee Love Festival, which is going to be cancelled for 2021 and will be reinstated for 2022. And I can confirm that we received copies of the documents that went out to the potential bidders for the operations for operating the event in 2022. Okay. So I'll move on to item 5, which is the primary care presentation. This is an update. So, well, first of all, can I thank everybody for coming again? This is great that we've had an update in January, and now we've got another one in March. So can I thank you for coming? We gave you a list of questions, and I appreciate there was some 15 questions on the paper. So I asked our officers, well, David Colville, to refine those questions. David, did you want to go through those questions, or shall I read them out?
I mean, I'm happy to summarise them if you'd like, Chair. Would you?
Yeah, it's probably worth summarising before we start the presentation on it, and then we can sort of be clear, because some of the things councillors might want to address separately. So if we can do that, and we can try and keep it to those 3 questions if we can possibly.
Thank you. Well, I know colleagues from the CCG have quite a lot of other information they'd like to cover as well. And can I just personally say thank you to them as well, because they're people we know well through our work on things like the new hospital and local health centres. But the 15 questions that were posed by the Task and Finish group, it's perhaps possible to put them into 3 categories. What lessons were learnt from the merger of GP practices and the development of primary care networks, and how will things be different in future? Some residents are dissatisfied with access to GP services. How does the CCG measure performance and seek to ensure that providers improve? And is performance information shared? My example would be patient groups. Members wish to be better informed in order to assist residents, including proposed changes in the way that services provided and performance, as we've already mentioned. How does the CCG intend to inform members in future? So that's a way of summarising the very in-depth work of the Task and Finish group.
Thank you. So we have, I guess we've got a presentation on this now.
Yes, shall we pass over to colleagues from the CCG who I'm sure want to introduce themselves?
Yes, please. Yeah, thank you.
Thank you, David. My name is Alma Gareth. I'm the Deputy Director for Primary Care and Medicines Management at North Hampshire CCG, and my colleague Matt. I'll let you introduce yourself, Matt.
I'm Dr. Matt Nisbet. I'm a GP at Crown Heights Surgery in the middle of Basingstoke, and I'm the CCG's clinical lead for business and partnership. We have got a short slide deck which we wanted to run through. We weren't sure if you already had that you were able to share, or whether you wanted us to do it.
I'm looking for if my colleague Ellie has
that's easier. Does that appear?
It does.
Yeah, that's fine. Thank you.
So thank you for inviting us to your Community Environment and Partnerships Committee. I'm going to start off, and then Alma's going to get into some of the detail, particularly on primary care, which I know that your members are very interested in. We can certainly touch on the 3 questions that you've summarised nicely there, David. I mean, I'm not sure how much detail we'll be able to get into. I mean, things like performance, Alma and I could probably talk all evening about, to be honest. So, but we can certainly touch on all 3 of those questions. The things that we want to cover in our presentation are a little bit of background about how we've got to where we've got to, really, how both primary care works and what the role of the CCG is. We want to discuss some of the work that we've done as a CCG over the last few years, some of the things that have gone well, some of the things that we could have done better, some of the challenges that we've had. And we want to talk a little bit about the future as well, how we can work with you as a local authority, particularly on some of the health and well-being challenges that the borough faces, and how we can work together to address some of those. So by way of background, I think we'll all be familiar with the kind of small business model of general practice, if you like, the independent contractor model, and the model where patients have a named GP who they'll often refer to as their GP. Historically, this model has worked very well. It gives doctors a sense of ownership. It gives patients a sense of who they can contact in the health service. And it's provided a very equitable, accessible service for patients over the years. Across the country, I think there is a sense that that model has come under pressure over the last few years, and I'll talk a little bit about why that is. So primary care is challenged everywhere, and there's a number of reasons for that. Partly it's to do with changing population. We know that our population is getting older. Partly it's to do with higher expectations, and partly it's to do with changes in the way that GPs work. Our work has become busier. It's become more litigious. We no longer work in an environment where it's safe for us to be woken up at 4 in the morning by having a separate doorbell over our bed, which our predecessors used to do years ago. And that has led to several changes in the way that primary care organises itself across the country. Some of this is a result of the kind of pressures I've been talking about, and some of it is a result of policy. So primary care networks is something that GPs have been asked to form, and GPs across the country have been asked to form themselves into networks covering 30 to 50,000 patients. So that's something we've been asked to do, but things like a diversification of the kind of staff that we employ is something which is both a response to pressures that we've experienced, and also a result of central policy as well. So at this point, I'm going to hand over to Alma, who's going to talk a little bit more about exactly what the CCG does and some of what we've been doing over the last few years.
Fantastic. Thank you, Matt. That's really helpful. The Commissioner's role traditionally is to commission services on behalf of the local people. And part of my role is, as a Commissioner, with my colleagues in commissioning, is to look at the primary care services, and those that are commissioned nationally, we support the implementation of that with those providers, general practice. We also look to local enhanced services. If there's any specific elements of the population requirements, we will contract that through something called local enhanced services. but also the future of investment into general practice to shore it up and move it into a place where it becomes more resilient, supporting its diversification of skill sets and a recognition of the workforce that is changing, and the reduction of available GPs is something called the Direct Enhanced Service, where over the next 5 years, there is a direct investment into growing clinical leadership, getting practices to come and work together in a cooperation, helping them recruit and diversify clinical pharmacists, physiotherapists, paramedics, mental health workers, care coordinators, dietitians. The list is quite long. There's about 10 roles they're bringing in incrementally over the next 5 years. And they become part of that multidisciplinary team that provides services to the local population. So while we're working on bringing and recruiting that in, that there's been some real positive moves on that. There is challenges also. There is a real appetite for this, alongside understanding what our patients' requirements are, looking at the population needs. And that is something that skill set is developing quite significantly over the last 2 years and into the future. And I think that was one of the things that Matt was referring to. And we do that through the relationships we've developed with our local general practice, but equally that is through a contractual mechanism, and that is the purchasing element of the commissioner. I think one of the things that we need to point out is that practices are contractors who sign up to provide the NHS services. So effectively, I suppose in really basic terms, they don't work for the NHS in traditional terms. And I don't certainly line manage them, or neither do my colleagues in the commission. We work collectively, collegiately and maturely with them. And there's a healthy relationship and healthy tension that we keep there. And I think the people who are very key to ensuring that we all work together as the patient participation groups. And one of the questions I saw that was put in the letter is, what have we learned from the mergers and changes that have occurred over the last few years and the pressures that we felt in the system? Certainly around Rooksdown, Beggarwood and Bermuda, is that patient voice, that element of having that patient participation group, their right to ask questions, them to be involved and actively involved in each of their practices and highly and represented. So we have progressed that significantly over the last year or more. And we have a very active group, which has been fantastic and has seen us through some of the other provider changes we've had around Rooksdown. Certainly as we work with Beggarwood, our PPG is really, really important to feedback on both sides, what's working and what's not working contractually and the service provision. And equally now as we move into the changes around Bermuda Mile, which has allowed us to keep the sites open. It's allowed us to flex the services. Okay, Matt, can you move to the next slide? Thank you. Matt covered this, but this is in a pictorial, and I apologize if this looks quite busy, but I think on that last line there, the top 5 things just focuses really quickly of what we're trying to achieve in the years ahead. We know there's an increased population. We know that our over 75s population are growing 4 times faster. We know that we have a high demand on the services. We've had a bumpy year, as you all know. This demand continues. We have to recover, we have to restore, and we have to deliver. We have to retain and recruit staff. You can see the significant numbers. And of course, there will be financial challenges along the way. But what we've learned is if we start to plan together, work coterminously with our other health providers and our community, we can deliver good services from that. Next slide. Thanks, Matt. So what do we use as a metric? So we were trying to share some of the patient satisfaction surveys with you. This is the national survey. We have other local ones that we were engaged with patients and PPG, but we just thought it was really important that we recognise that access and getting through to general practice remains a challenge. And that is something, while it is 65%, and I'm sure there are many of your constituents who constantly speak to you about this, we know that this remains a challenge, is one that we're focusing on to continue to improve. But overall, what we are grateful for is the experience has remained positive. We know we have work to readjust it in relation to patients' experience through COVID. That digital element of that has now been added in, and what has that been like for patients is still really important for us to work through. Or PPG works with us on that. Patients' needs met around appointments, obviously it's one thing we measure, and the availability of appointments. Patients still require access, and we're just trying to determine which access. Is that to a GP? Is that to your physio? Is that to your clinical pharmacist, mental health worker? That's the kind of specifics that we really are starting to drive into. And it's the patient's voice and experience is the one that we're having feedback. One of the things that the services we've been providing is around the winter assessment hub that we got up and running through our COVID experience to start to look after patients who were potentially symptomatic of COVID, and we felt we needed to just wrap around them, triage them, and look after them and keep them in primary care as best we could, or divert to the hospital for treatment. That was quite a change for patients who were coming in and then having to move to a practice that they wouldn't normally see. So that survey is ongoing at the moment, but currently we saw over 3,000 patients, apologies about that. So with that winter assessment hub, that is one of the areas with those 3,000 patients that were seen and looked after at home and kept at home, is a survey that we're working through with the PPG. One of the other pieces of work that we're running a patient survey around is the COVID oximetry at home, the pulse oximetry at home. This was what we used by keeping patients at home, looking at their SATs and connecting with them every day, just to make sure for over a 14-day period, using our general practice as clinicians and other clinicians alongside through SCAS and the hospital, to ensure that they were safeguarded through any of their symptoms and just to see how they were progressing. So that is some of the successes that we have worked through this year, and again, using the patient voice to see how that has worked for them. Next slide, Matt. I think I've covered quite a bit of that. Do you want to move to the next slide? One of the things that we're using to help us rethink our primary care integration and help our discussions with general practice and around the contracts we are putting in place equally with our patients is we use a gentleman by the name of Stan. We equally just have to put ourselves in that place of the patient of what they want. So a lot of our services are checked by many of these questions. When I need care, when I need help, when I need to recover, when I'm unwell, when I need planned care, what does that mean for me as that patient, irrespective of their age? And that is one of the things that we use to underline a lot of the services that we currently have in place and the ones as we design them as we go forward. And this is Stan, so I'd like to introduce Stan. So, Matt, next slide. Another element we've had to really work quite well, actually, and I think has safeguarded us through this year, is something called a one-team approach. This is by looking at multidisciplinary teams, agnostic to health organizations. We have had SCAS, we have Southern Health, we have our specialists from the hospital, we have our GPs, our nurses who come and work around patient care, around reactive and proactive care within general practice. And this has been a real great experience for the staff. It also has, we've seen fantastic clinical leadership from our GPs, really getting on board, and also doing it through a time where we've had to digitally mobilize ourselves, and has actually freed us up to do quite a lot of work. So we've been able to, through COVID, is use these multidisciplinary teams to manage the proactive care of patients within their own homes and around their needs. One of the areas we focused on significantly was frailty, and another part was respiratory. And the feedback, we're doing an evaluation of that for staff, how that has been. We're also looking at the evaluation of the outcomes for those patients. Did those interventions with this multidisciplinary team really improve the care of patients. So we're working through that at the moment with a group called the Academic Health Science Network, which will be putting numbers and experiences around. Next slide, Matt. This is just some of the highlights from COVID. You might have thought you might have got away with not hearing about COVID tonight, but this is just some of the innovation that we have to escalate really quickly around digitalization, working together, remote access, all the contacts that we had to make around the shielded patients. I think that was one of the real positives that came out of this, was having to learn how to access them really quickly and put support in around them. A few bumpy starts, but we definitely through the vaccination program have been able to prioritize and identify them really, really quickly. And we're currently have quite a significant amount of them already vaccinated. Matt. And just as one of the things that I just wanted to share, we have the COVID vaccination centre that has been run by our local general practice. We have the 6 PCNs, 15 practices who have come together, and they've grouped together to provide the vaccination programme. And they opened up in December, and they have now vaccinated over 50,000 patients. They have 400 people rotated in to support them, a real mixture of volunteers, staff from other organisations, health staff, people coming on board, learning and being trained to provide vaccinations. And we sent out a survey just to check what is it like for them. And we've had a really positive and strong response. But what I love is the fact that our community has come back and responded. Our patient, our marshals, our car parking advocates, the very resounding response from them. And they've been a real key member to this being a success. We couldn't have done it. And we have sat up and taken notice of what our community has really enabled us to do. That. And I think there was just some of the patient feedback that really helped us, give us the energy to drive things on further when you get that little bit tired and you're just trying to keep delivering. It was just so lovely to get this feedback. We've got some feedback that also has told us how to improve that service, and the GPs and their teams have been incredibly responsive in doing that. My favorite one was the second point around someone who suffers from anxiety, coming out of their home into an unusual environment to get a vaccine. They felt that service supported them through it, and I feel really proud of that. Matt? So Matt, I think this is the challenges going forward you would be happy to pick up on.
Yes, so this is a little bit about challenges and a little bit about our priorities moving forwards. You'll be aware just from opening a newspaper that there are challenges around workforce in primary care, and that's one of the things we're trying to address by recruiting a wider pool of staff to work with us, and increasingly we're looking to work both on physical and mental health together in the way that we think about things. So rather than think about them as being separate entities, to think about them as being part of the same thing, if you like, because we're all one person at the end of the day, aren't we? One of our priorities is reducing and tackling inequality. And another one of our priorities is thinking harder about the population that we serve. So public health has always been one step removed from general practice, really, and the fact that it's run by Hampshire County Council on a county-wide basis means that we will often not have very much contact with the public health department. But increasingly, GPs and primary care networks are being encouraged to use a population health approach to analyse and assess the needs of our local population. And you probably won't be surprised that those needs vary quite significantly across our patch of North Hampshire. In fact, I was talking to a colleague as part of the vaccination programme. I was talking to a colleague who works in Overton the other day, and it might not be a surprise to discover that the number of Black, Asian and ethnic minority patients who fall into the top 4 cohorts for COVID vaccination in Overton numbered something between 30 and 40, whereas for my practice in the middle of town was closer to 400.
Mm-hmm.
So we have quite a varied population and varying challenges across our patch. As we move into an integrated care system world, it will be increasingly important for us to operate across organisational boundaries. So increasingly over the next 5-10 years, we're going to see services that have been provided in the hospital being provided in the community, and increasingly I think we'll be seeing staff from different organisations working alongside each other on the same projects in the way that we've demonstrated we can at the COVID vaccination hub. And I think that's particularly relevant for local authorities because as we work across organisational boundaries, of course, that includes organisations that are not health bodies as such, but local authorities such as yours. This is our last slide. Actually, I think I've covered all of that, talking about equality, working together with our patients to develop solutions and thinking about inequality.
So Matt, having read through the questions that have come in, we've covered some of those, the answers to those questions in our presentation, but I think there were a number of questions in there that we haven't probably covered specifically. So I'm just wondering, is that something that you want us to take away and to respond back to? Putting it back to the floor.
Well, I'm quite happy for you to respond back to it. I mean, we'll open up to questions in a second, but I mean, is that your presentation finished now? Yes, thanks for that. So can I open up to councillors? Do we have any questions? Councillor Vaux.
Thank you, Chair, and thank you, Matt and Alma, for a very interesting presentation, which I think shows how much has been going on in health, all at the same time, with the COVID pandemic, but also coping with the normal health requirements that we have at primary, secondary and tertiary level. It's been a very, very busy time, and restructuring as always with the NHS. So I have a couple of questions. I'll just stick to the two and see how my colleagues how many questions they have, because I don't want to dominate this. But there were two things that particularly came to mind. One is with the PCN structure, which does, from a patient point of view, seem to be working quite well. How will that flex and work with the fact that most GPs are private contractors and most of their organisation is a private contractor? How will that work and flex around all the development that we've got going on around Basingstoke and the borough? Because there is often, as in the way of these things, there's a development and then everything's creaking, and then it takes another 5 years before we can actually expand the medical primary care, and it's actually quite a poor experience for people. So that was one question. And then slightly related, the CCGs are all combining. So the North Hampshire CCG will be merged into one great big Hampshire CCG. That feels like we maybe, probably a bad analogy, but Hampshire County Council is huge. So if there's one huge Hampshire CCG, I'm very concerned about the lack of local feel to health here, and I wondered if you could assure us about how that will be managed, that it will still feel pertinent and relevant to us.
Sure. Thank you. Matt, do you want to take the first one? I can answer the first one unless you just want to jump in.
Yeah, I mean, PCNs is a really interesting question, isn't it? I mean, PCNs are are fairly flexible, actually. There's not very much that's fixed about primary care networks. So just by way of example, in North Hampshire, we have 6 primary care networks. In Mid Hampshire, covering the Winchester area, with a very similar population, around about 220,000, we have 4 primary care networks. So the way they were set up really was they gave us quite a lot of flexibility to form networks which made sense to local people, to local GPs looking after local people. So there is certainly capacity within that structure for them to adapt and flex as populations change and grow. The question about CCGs is a really good question, and I really understand your concern around that. I think the reassurance in it is that, I mean, when CCGs were established, one of the primary objectives was that they were clinically led and that they were locally focused. And I think to a large extent they've succeeded in that. Whatever we thought of the plan back in 2012, they have been successful in those things. But there have been things that have been kind of lost a little bit in that as well. And I think from Hampshire County Council's perspective, suddenly having to deal with 6 different CCGs, they previously only dealt with 1 primary care trust, in relation to things like social care has been difficult. And so this latest structural change is designed to address that, really. So the challenge for us is to try and address that in a way which doesn't lose that local focus and that clinical leadership. And so whilst it's true that in April, the CCGs will merge into a single one covering Hampshire and the Isle of Wight, we're very much retaining a local structure as well. So there will be a single board across the whole of Hampshire, but we also have a local integrated care partnership, which covers just our area of North and Mid Hampshire, and which retains the input of local GPs like myself.
Thank you, Matt. Chair, could I just come back with one little clarification? Yeah, thank you. So on my first question about expansion, I think whilst the PCNs are great and they're very innovative and flexible, it's the buildings often that's the problem. And I think buried amongst all these questions, because there are a lot of questions that came from the Task and Finish group, for which I apologise. I think it is that those structures that cause often a lot of the delays. Yes, I accept that we are shifting to more online and more video, etc., but there is always going to be a need for buildings, and it's those delays that cause a lot of anxiety for local residents. And I think that is an area that close working with the borough as a partner in the local PCN structure and local whatever CCG structure type will be here, it becomes really important, and which is why we've encouraged this conversation this evening, is that we do keep in touch both what your challenges are and how we might be able to help as a council.
Thank you, Jenny. It's something I have observed through this COVID experience. There's been a real mix in some of the workforce who has had to come out of the offices and work from home. And my colleagues that when we work on the multidisciplinary team who from social services, they had adjusted quite a bit of that very early on. And what we have observed from them, they were more advanced in that experience and were able to support us as health of what that looks like and still to get the outputs and outcomes for patients. So that has shifted us in our thinking and to flex the estates because we are not awash with estates. It's also made us look at that clinical space is what is the current really important currency for us, and whether the workforce could coalesce in another building. How do we connect digitally, but without losing quality or actually improving quality, because we take that proactive approach to find the patients using population health and proactively supporting them in advance. And the digital piece allows us to do this. So that has been a real success for those who are digitally capable, but it allows us space in the multidisciplinary teams then to focus on the ones that need that extra support and are potentially underserved because of the digital. So that's what we're working with.
Yes, I think there's also co-location possibilities.
Yeah.
You know, if you just look now, the vaccination centre at the fire station, the borough have provided a lot of staff for that vaccination centre. I mean, myself and other councillors here have volunteered at that vaccination centre. So I think there is a lot more partnership working that we could do. So thank you, Chair.
Thank you. I've got Councillor Taylor and then Councillor Kinnear. If there's anybody else who wants to speak, just let me know. Councillor Taylor.
Thank you, Chair. Thank you very much. It was an interesting presentation, lots of useful information about what's been going on in COVID. For me, it's a little bit off topic in respect of the motion that we put forward and that we had in December, which is very much about lessons learned, how they would translate into KPI that need to be considered, what the early warning signs are that you identified from lessons learned, and how you will build KPI for those. I really didn't hear anything about that. I mean, I know you say you had some lessons learned and you sort of mentioned, oh, we really ought to listen to the patient participation groups, and presumably there's provision for doctors in the surgeries to sort of communicate with them, or there's an expectation there will be. But in terms of lessons learned, I would be asking questions like, what did you learn in the initial contracting process? What did you fail to check that you could have checked that might have been an indicator that the problems that happened in Rooksdown, and obviously with the Acorn practice, what did you miss as part of that process that was really you should have not missed, or you should have been inquiring about, that would have given you some indication of stability and suitability of these people as being suppliers? Things like past performance elsewhere, complaints about them elsewhere, previous reports, company structures, company ownerships, where they are in the world. Are they venture capitalists, for example, like they were in the case of Rooksdown and Beggarwood, and therefore have very little interest in healthcare. So I didn't hear about any of that from the contracting process. I didn't hear about how that would have informed or developed KPI that you will now be measuring to check that these contracts that you give out work properly, or any early warning signs that you've identified that you should monitor for the future. I would have thought one of those things would be doctor numbers, for sure, since the ability of Centene to recruit doctors is one of the key selling points for them taking over that particular contract. So I would have thought we'd like to monitor that and whether or not there are sufficient GPs. And I do understand that the Quality Care Commission doesn't set an exact ratio, but there has been plenty of research that indicates what that ought to be safely. And I suspect we're going to run into some difficulties with that, especially if it's not monitored. I'd like really to know about all of that, and about the KPIs, and about how you would anticipate meeting with us as a council every few months, every quarter perhaps, to discuss those things and to see how things are going along. I'm particularly interested to know how formally you as a CCG will connect with patient participation groups. Sure. On their own, without the GPs, without the doctors, because that we've had some really good feedback about the problems in connection with that and them being dismissed. And even in a meeting just a few months ago, when I raised this issue, I was dismissed, I felt, by the GP practice when I said, well, I've been getting problems reported to me by the patient participation group. Rubbish, I was told. That's not good enough. You know, I knock on people's doors and sometimes they happen to be members of these patient participatory groups, and they give me an earful because things are not working. So I want to know how exactly you are formally and precisely going to be taking on board their feedback, because the clear message that I've received from them is that they were consistently ignored in the other practices, and therefore early action was not taken to resolve the situation. So I want to know specifically how that will be overcome. So really, what lessons were learned in all parts of the procedure? How is that going to translate into early warning signs? How will that translate into KPI? What kind of KPI? Doctor numbers ought to be there. And how is that going to get fed back to us so that we can be assured and talk with confidence with our residents about performance and about what's happening and about how it's being monitored. And I think also, you know, exactly, you know, how are you going to, moving forward, properly communicate with local councillors and the council? Because it is not sufficient to send an email to the council as a corporate body, because they are not the local councillors. And it is not sufficient for us as local councillors to get a letter or an email a couple of days before something happens. And you know, local councillors are pretty put out about that, to be honest with you. You know, it was inexcusable, really, and it was pretty much an afterthought. And we would like to see that changed quite significantly. And in respect of that, I think you know, I'm already being approached by residents right across the board who want to know what exactly is going on with Bermuda and Marlow. What's the position? What's the latest? Who's taking it over? And also with Rooksdown and Beggarwood, their contracts are coming up soon. What's the position there? They're trying to get information. They feel they're not getting it. So there's quite a lot there, really. But it brings it back to what the motion was originally about. You know, I'm not trying to dismiss the hard work that you do, but that wasn't, you know, what I was looking for, really.
Before you respond to that, thanks, Councillor Taylor. It's very, very useful. There's a lot of questions there, and I don't know if this of tonight is the right place to answer those questions. Maybe you want to go back and sort of think about those questions and maybe give us a formal reply. We do have a communication channel through Councillor Simon Bound. And he's our single point of contact at the moment. And obviously there's this committee which we can all address further issues with. So would it be appropriate to use that as a channel?
I wonder if I could comment, Chair, only because I was quite involved in the Rooksdown Beggarwood experience, and all of these experiences are unique because the organisations that are running the practices are unique. What the signs and symptoms of failure are seem to be unique, or sometimes the same. But I think there's also something about engagement with the CCG, because do you know what, for all of the failings for the Rooksdown practice, when I made contact with the CCG, they were exceptionally good. And I would thank people like Matt specifically at going, do you know, what are you hearing as a local councillor? Give us the intel, pass on the complaints so that they can bypass the local practice, so that if there's a particular patient issue, it can be resolved, and then records can be kept as far as what issues, how many issues of what category are kept. And within the quality team, and forgive me if that's the wrong name for it, but that seems to be their job within the CCG, building up a level of sort of local intelligence about what is or isn't going right or wrong, so the CCG can ask those questions. Now, it was, I think, particularly frustrating both for the CCG because of the type of relationship they have with the local practice once a contract is given, and Councillor Taylor's quite right as far as what lessons have been learnt about how contracts are given, and I suspect the CCG will say we can only assess certain criteria with evidence that's provided to us, and that's laid down in legislation, etc., etc. But I think what I would say as far as a local CCG is concerned is did it go on for longer than any of us would want? Patients, CCG, me as a local councillor, the Beggarwood and Hatchwarren councillors, then absolutely. But do you know what? We got the result in the end, and I would say it wasn't for the sake of trying by the CCG, listening to us as local councillors and giving us feedback. Now, one of the lessons that we may all need to learn from that is, how do we create a positive relationship between ourselves and the CCG? And that may be something that we need to have those conversations on an ongoing basis, because Councillor Taylor's quite right, that's, you know, because I saw her shake her head, that says, you know what, corporate communications between us as an authority and the CCG isn't how it's going to work best. How it's going to work best is at a much more human level, to say, do you know what, I had, as a local councillor, I was given a contact at the CCG that I could pick up the phone and say, this is what I'm hearing, and actually it was taken seriously, and I know the CCG were doing what they could with it. And I think it's some of those things that perhaps we can talk about. I think at a corporate level, I think it's fair to say that, you know what, the North Hampshire CCG, now going into the merged Pan Hampshire CCG, probably does need to think about what's its estate strategy, what's its digital strategy. And you know what, I'm sure that's on the list of things to do once they've finished testing, running hot hubs and the amazing vaccination centre. But there is that question that even at a formal level, we put into the consultation about the merging, that said that this local communication was vital for us, and vital for us as Basingstoke and Deane, because you know what, we do have a lot of growth. We want to understand the estate's policy and strategy that you have. And do you know what? We'd also like to invest, because you're brilliant people to invest our money and our resources and our buildings in. We just need to get you to be better at being able to invest in. And that's something that we're desperate to work with you on. But absolutely, thinking about that, sort of what happens in individual practices and those relationships at a human level, I think is really valuable. And I would hope that we can start building that as things settle down coming out of COVID, because I don't think the CCG will say this, that I would say they probably saw local councillors being a little bit of a pain in Rooksdown and Beggarwood to start with, but knew why we were being difficult, knew why we were asking difficult questions, and we were probably unreasonably frustrated at certain points, and you probably wish you could say things to us that you couldn't, and for all sorts of positive reasons. But actually finding a way around that at a human level is going to be really important going forwards, because there's a lot of change going on and patients will have lots of questions as things change.
I think, thank you.
I'm sure that Alma wants to say a few things about the contracting, and she was much closer to the specific contracting issues around Rooksdown and Beggarwood than I was, so I'm sure she wants to come in on that. But just to address some of Councillor, and I'm sure you're right, Chair, that we can't go into a huge amount of detail on all of Councillor Taylor's points, but just to address one or two of them. I mean, the way the questions are worded, what did you fail to check that you could have checked? What did you miss? These are quite kind of accusatory questions, Councillor Taylor, and the implication in the question is that we missed something. And actually, I think maybe you misunderstand the nature of the contracting relationship and the powers that CCGs have. So actually, if partners in a practice wish to take on an additional partner, unless the CCG has very specific quality concerns, which have to be evidenced, then there isn't anything that the CCG can do to stop that from happening. And it doesn't matter whether somebody's backed by a venture capitalist or Richard Branson or whoever it is who you might find distasteful. The CCG took quite extensive legal advice, as you would expect from an organisation spending a large amount of public money in this regard, and that was the advice that we received. So I would absolutely refute that suggestion that there was something that was missed. You talk about doctor numbers, Councillor Taylor, and you know, one of the things that attracts doctors to working in a particular area is how it is to work in that area. You know, there is a shortage of GPs in the UK, and doctors have a choice of where they want to work, and places that generate exciting opportunities for doctors, places that have vibrant relationships between health organisations, and local authorities, look to doctors like exciting places to work. And if I may say so, Councillor Taylor, having headlines that say that to say that primary care is third world somewhere probably doesn't attract doctors to work somewhere. So we'd really like to work with Basingstoke and Deane as a local authority. I would agree with you that that us churning out corporate communications probably doesn't help, but equally I would suggest that you slinging mud at us through the pages of the local paper doesn't help either. We meet regularly in formal meetings with the councillor's portfolio holder for health, and I see that as an appropriate way of maintaining a relationship. I'm sure Alma wants to say something too.
Yeah. Thank you, Matt. Thank you, Councillor Taylor and Councillor Bound. I think there's a really fundamental piece here, and I hear Councillor Taylor's, you know, frustration in trying to look after her constituents and that and what's required. We do take legal advice. We absolutely will flex to deliver the quality and the services that are available, and through the powers that we have as a commissioner with what we buy. That is quite challenging when you're working with the private industry. That is free to make their decisions also. What you'll find with the practices that you're referring to is the quality metrics that were available and the key performance indicators were all, not all of them, the majority were fine. They were good. They were ticking along just lovely. When we spoke to the patients and we got the feedback on that, we would go back, we would have those conversations and to move things on. What we found very, very difficult was that relationship piece, and that's the local piece I think we're all referring to, that's going to weather us through this change, transposing relationships, whether it's with the council, or we have good relationships with our PPG, and now with the practices, which is really strong. And you referred to Bermuda Marlow. The learning that we've taken from our previous experience has allowed us very, very quickly, even though that practice has shown to be CQC was in good shape, its doctor numbers looked okay, there was many things that looked fine, but we got in early and we were able to work, and we're in there now working with them, and we have a successful outcome for those patients going forward. And it's exactly where we wanted to be and where we needed to be based on the feedback and the relationships we've got with our counsellors and our patients and the community that's there. These things take time, but it's relationships all the way. And that's the most local thing and most valuable piece that we can have going forward. We can have all the contracts, KPIs, everything we want. You know, people can manage numbers and manage conversations whichever way they require. But when you know someone well and you're constantly connected, you can have a better influence and early warning systems that I won't find on the spreadsheet.
Thank you. Councillor Taylor, do you want to come back on that?
Thank you. I mean, I'm not responsible for what the Gazette prints, to be honest with you, so you'll have to take that out with them. Or indeed, if one gets misquoted or incorrectly attributed. What I would say is that we have asked about lessons learned, and therefore we were expecting some detail about that. And whilst I appreciate you may have a particular contracting process, most commercial contracting processes do have things that they check and the things that they look for. And, you know, in my experience as a management consultant, generally speaking, the first step in solving problems or issues is to actually recognize and accept that there might be some, as opposed to just saying, you know, there are no problems, there were nothing that we could have done. You may have a legal framework that you work for, but what might have happened that could have been different outside that legal framework that might have informed you? And doctors' numbers are important. we do need to know what is a reasonable ratio of doctors to patients in a practice, and is that ratio anywhere near being hit? I think it's a perfectly reasonable question to ask. It's what our constituents are asking us, and you need to think, why are they asking us those questions and not the doctor's surgeries?
And I'm very happy to take you through that and get those references to you for you to reflect on with us, but also probably adding context around it for interpretation.
But if I may, Councillor Taylor, the committee, whilst we're very happy to come and talk to the committee doesn't have a formal role in holding the CCG to account. I think you mistake the nature of the relationship between your committee and the CCG. The CCG is here as a strategic delivery partner to assist the council in improving the health and well-being of the population in Basingstoke. So, again, I reject the proposition that your role is to hold us to account.
And can I just add to that? Again, thank you for coming tonight. It wasn't my intention to sort of grill you on anything tonight. I'm quite happy for you to take away any questions raised tonight and come back to us. Can I hand over to Councillor Kinnear?
Right, well, I would first of all like to thank you, Chair. First of all, I'd like to thank Alma and Matt for coming this evening and giving a very good presentation, which I found very interesting. So I would like to thank you both for coming back. Thank you. I'd also like to say that many residents from the Kingsclere ward area that I cover have given really good feedback on your excellent vaccination programme. So well done on that. I've also had some feedback from the Watership Down Health Centre, which is covers Oakley, Kingsclere and Overton. There used to be quite a few online appointments available to book. That doesn't seem to be the case at the moment. Please don't take this as criticism. I'm just relaying it from residents. So thank you very much for attending tonight.
Thank you. I mean, one thing that's coming out about this is there are issues, and obviously our councillors are getting very passionate about the residents' issues. We do need some sort of communication channel, and I can appreciate that you're doing your business, and this is probably just fine tuning, or it's sort of sorting out teething problems. But can I suggest we pass those through Councillor Bound as a single point of contact, and that's probably the most efficient way of doing it. We still will have these meetings, and it's great that you come and update us on them. But if there's any immediate issues, maybe councillors go through Councillor Bound and speak in that direction or that channel. Councillor Bound.
I wanted to just repeat the experience that I had in Rooksdown as a local councillor when I approached the CCG to say these are the specific cases where I had specific concerns about things which either I would categorise as customer service, so the phone wasn't being answered, or actually care concerns for people's safety and health, that actually the CCG was incredibly responsive in making sure all of those cases were dealt with and checking up to make sure the patient was satisfied. And that I absolutely know that was collated in their bank of information, because there is everybody in that system is concerned about patient health and patient care. So that's at the top of the list for the CCG, and we had some really honest, open conversations about what was going well and what was going less well in local practices. And actually, I know as a local councillor, the CCG understood my concerns and shared with me what they could and couldn't do. And I know they were as frustrated as me a lot of the time that they didn't have some of the powers that some people would hope that they had. And I'm sure the CCG would wish that they had as well. And I think there's that reality that says I'm very hopeful, because we've had such a brilliant relationship with the CCG, with COVID and with some of the developments regarding new practices. St Andrews is a prime example of that. But do you know what? I hope, looking at our challenges, that we can do a lot more when we start looking at inequalities. You know, we can start looking at how we analyze data, because do you know what? We probably have all the information that we need and the resource and the motivation between us to deal with lots of those issues.
And just if I could add briefly, it's not just Councillor Bound that we've had those kinds of conversations with. You know, Councillor Bound obviously represents Rooksdown, and we had very similar conversations with Councillor Terry Reid from Beggarwood as well.
Thank you. I have Councillor Jones next.
Thank you, Chair. I'm really going to just say something, because I do apologise. I took ages. I couldn't get on earlier, so I've missed half your presentation. So if we got the slides, or well, I don't use slides now, but if you could send them, that would be good. Yeah, the only comment I'd like to make really is there has been a problem, and there's no good hiding behind, you know, we're knocking the doctors, the surgeries. The problem is that the patients were saying to us that there's a problem, and we're trying to get that across. Now, that's down to communications. Now, some things we would like and the patients would like may not be able to get them. But if we had the communication, we may have actually saved a lot of this problem. You know, when we've had this COVID, and I think everybody around this tables these days would agree that what's actually happened in Basingstoke, well, no one can knock. They're excellent, but there's something wrong before, and that's where we were getting concerns from, and it's how these communications get put forward. As a patient of Acorn, I remember when they was first coming out, we didn't have time to respond. They were going to respond to us, so I just picked a leaflet up when I was actually in the doctor's surgery. Now, I know I got a letter, and it was too late to do anything about it. Now, if you don't want us to respond, don't send a letter. As a business, you want to go ahead and just do it, fine. But I do worry that we're trying to look at this as if we're having a go at the doctors. God, we'd want them there anyway. But someone's got to recognise that communications weren't good enough, in my view. That's not having to go at individuals. And now my concern is, and as I said, I didn't see all the presentation, but we're going to one CCG for the whole of blooming Hampshire. And I'll be perfectly honest, it frightens me to death, because I've been dealing with Hampshire County Council over the years, and that is hard going, trying to get anything done locally. And that's the comment I'd make. But it's not a have a go at the doctors week. I want to see it resolved for the patients. I'm one of your patients. I don't want to be left standing there, but I've got a lot of, I'll be honest, I've raised it before. You know, you pick up the phone, go online. A lot of my people aren't online, and things like that. Now, that was recognised, but are we really dealing with it? So that's where we want some communications in that area, I believe, and what is actually happening, how we're getting around it, how many patients are not responding to the doctors these days because of COVID and because they can't be bothered, because every time they ring up it takes so long. But I will give you a heads up, when I phone up now, you can queue up and it works very well, so I'm really happy that you're number one, they phone you back and everything else. So there has been improvements. But I think sometimes we've got to look at this as if there's something wrong, let's have the communications, because our constituents don't get hold of us for doctors normally. They ain't the norm. I've been a councillor for 28 years, and if it comes to this, only this last, 5-6 years, maybe less than that, that people have been making comments. And I'll leave it at that. But I don't think we're here to knock you. We're trying to resolve issues we're picking up, and I'd like to see that you're actually accepting that. Councillor Kim Taylor, she's responding to what people are saying. She's not making trouble for the sake of it. And I do get annoyed when that seems to be what's coming out. So I don't think it is, personally, but I'll leave it at that. Thank you.
Thanks.
Matt, would you like to respond to that?
Yes, please. Thank you. Thank you, Councillor Jones. That is one of the reasons why the PPG, we recognise that the communications and the link into practices and through into the commissioner from the patient participation group wasn't as robust or as independent as it could have been. So one of the key areas that we're working with through Nicola Decker, GP, Clinical Chair Commissioner, has been working tirelessly with them to move them into a position for them to understand and the right that they have to question, respectfully question, speak to their general practice, and they are connected in, and we meet with them every 2 weeks. So a lot of the quality issues now are coming to us incredibly quickly. As a commissioner, we don't sit and set the agenda or service that for them. They drive it and we respond with them. So the telephony issues, while they took a very, very long time to resolve, we've got them resolved with them. The ones we're looking at the moment is eConsult, which has arrived in quite significantly. And whether they feel their voice has been heard is the question that we're having with some of the practices at the moment. So there's some key elements around that quality piece. While it might sound really technical, it's having a negative impact on patients' lives and how they feel about their services from general practice. So as a commissioner, we are in there. I say the word commissioner, or colleagues who have built relationships are in there with those PPG now to build that confidence to get some of those solutions, and we take them back as the evidence base for that conversation back into practice. So that is the most significant learning we've taken, and it has had a positive progress on that. We're feeling we're getting somewhere. Those patients are getting somewhere with the practices on that. And we want it to be a good experience for everybody. You make a change, make a positive change, you continue to invest.
Thank you. It is positive. I mean, it's great to see that you're putting tools in place to deal with these issues, and obviously you're changing your dynamics all the time. So these things are going to change as you change. It's a shame the local press don't pick up on the positives, isn't it, sometimes? But anyway, Councillor Hickling.
Cool. Thank you, Chair. I'm going to keep this nice and short, hopefully. And this is nothing that you feel free to respond to today. You can get back to us on these, along with the remainder of the questions from the Task and Finish group. I'm conscious, or I'd like to ground all of your presentation and your responses in performance, essentially. That's what I'm primarily interested in. Thanks for the presentation. Your plans for the future certainly sound really interesting. But along the lines of performance, how are we judging that that's going to be a success? You've mentioned already that current KPIs are looking fine. So from that perspective, what constitutes fine? Who defines what fine is? And how has fine changed over the past 10 years? I'll be honest, I want to know stats off the top of my head, things like average wait times over the past 10 years, how they've changed, and how you see them changing in future. Yep. So performance criteria of your plan moving forward. What effect is that going to have on things like wait times, on things like need for reoccurring appointments, total appointments per individual over the course of 12 months? I'm sure you're keeping all of these stats somewhere. It would be great to know what they are, how the landscape is changing, because then, you know, if you've got people referring to the services in the borough as either third world or perhaps Basingstoke's a leader in the area, I'd like to know. And if those stats are transparent and available, that would be fantastic, because then obviously that gives us something to judge the current status against and future status against. So really, that's all I wanted to say. And I hope when you come back to us, either again at a committee meeting or via Councillor Bound, that we have those stats, they're available, and we can publicise them and make educated decisions off the back of it. Thanks.
Alma, Matt, is that something you want to respond to?
Absolutely. Yes, Councillor Hickling, we have all those performances. We have many performance indicators from the number of appointments that are offered on a weekly and a monthly basis. We have that in comparison to the amount of touch points with the hospital. We have prescribing indicators, which are in the public domain. We have quality indicators, we have GP numbers, we have nursing numbers. We've got lots and lots of numbers. And that is available, and that it does look practice to practice, and that will be across Hampshire, and that is nationally. So yes, you will be able to see that, and that's fine. So the performance indicators will be there. What I also would like to point out is that the real depth of the question is the quality of the outcomes of those interventions is the other element that you really need to be looking into, and that's what we're working with all general practitioners to do that. And there is some great data that's there, and this is this population health management, because once you get you're full with performance indicators, the natural next question is, are we getting what we are buying in a level that we're really happy with? And forgive the use of fine. For someone who likes numbers and performance indicators, I know fine isn't a good word. Trust me, I like data. So we do look at that. But it's the outcomes is what we really want to be looking at. And that is the pathways, the clinical outcomes, NICE guidance that we are achieving all of that alongside the indicators that shows we've ticked the box and done the transactions. Yeah. Which is really where we want to get to. And that's our quality colleagues are driving that, and the health improvement guys are driving that. So I think bringing the two together.
Councillor Hickling, do you want to come back on that?
That sounds fine. Thank you.
Thank you, everybody. Has anybody else got any more questions? I've got David Colville.
Sorry, it was obviously not a question. I was just going to say, if I liaise with Alma and obviously through Councillor Bound as well, and see whether the best way of providing members with information.
Excellent. I mean, to be honest, that's very good that we've got that communication channel open. You know, I just want to reiterate that we're not here to put you on the spot and interrogate you, but you know, we want to work with you and help you and help our citizens of Basingstoke. So once again, I'd like to thank you for coming in. Before you leave, can I just mention that there was a couple other injection centres which we worked at, and we just want to acknowledge those as well, because I mean I did a couple of shifts at the fire station, and I really enjoyed myself working there. There was a good bunch of people there, and even the helpers or people who were working there, they were taken from airlines which had laid them off, and they were being used for that purpose. There was one lad who was he was made homeless, and it had given him some money for accommodation and stuff. So there was a lot of good news stories down there, and it was really heartwarming to be part of that. So thank you.
Thank you very much.
So I'll just move on to item 6, if that's okay. So this is the care leavers and corporate parenting update.
Thank you, Chair. It's me again to begin with. My colleague Jane, waiting, is there as well, who's more of an expert than I am. But members who were part of this committee last year will know there was a report in January 2020. I think members were interested to understand how services for care leavers are provided and the Borough Council's role is in this. So that report was presented, and an update was requested earlier this year. We have reproduced some sections of explaining how things work, because we thought actually not all members would remember, it wouldn't be on the committee. So we have tried to explain how things work, and that includes the fact that obviously Hampshire County Council is the lead authority, and there's a corporate parenting board at County Council which received a extremely long annual report I was looking at earlier today, explaining how services are performing, including within, if performing is the right word, but how services are performing, including within Basingstoke and Deane. So there's a clear accountability within the corporate parenting board at Hampshire County Council. But the report does expand on some of the support that borough council services are able to provide to care leavers. So it's a relatively small number, but obviously it's the people concerned. They can have very varied needs. Some may not require a lot of support from the public sector. Others do require a lot of intense support. So it's very much tailored towards the individuals. But services mentioned in the report, including housing colleagues in particular, and Rachel Fletcher is unable to be here tonight, but Rachel does a lot of work with people, including care leavers. So we probably, unless there's anything Jane wishes to add, it may be best if we just move straight to your questions.
Yeah, that's fine by me too. Nothing to add.
Okay, can I open up to questions? Sorry, was that Councillor Mahaffey? No, Councillor Taylor.
Thanks for this. It's a really good update from the report that we had before, and this is a really important set of work for some people, young people that tend to continue to be vulnerable long beyond when we might expect normal youngsters to leave home and be supported by families and so on. So the work that we do on this is really important. I had two questions to pick up on sort of around paragraph 2.4, which is really about the auxiliary stuff that sort of goes on to support this. I mean, it talks into 2.4.2 about our grants, so community grants, and how those are funding things that these young people might be able to access. And I just wondered if you could give us a flavour of those and whether or not any of those relate to, you know, support they might get for mental health, for example. And in 2.4.5, you sort of identified the number of people that have come along for some support in respect of housing advice and so on. And I just wondered if you were able to tell us what the sort of outcomes were for that, because it's always really interesting to know if we've managed to help people.
If doesn't mind, I put my reading glasses on to show my age and look at the grants report that actually went to cabinet a few weeks ago. There weren't any specific bids for in the allocation of programme grants. There weren't any bids that dealt specifically for care leavers, but it was more around organisations, both for the strategic and the programme grants, that support young people who you know do so. For example, there's outreach activities. There's the one that's actually in front of me, a weekly outreach programme for unattached young people within the town centre area. Various activities that this organisation is going to be put on. So the fact that that's a grant that's gone for unattached young people in the town centre, it doesn't mean that they're all care leavers. But actually, we know from experience there may well be town care leavers who are in there. Similarly, I won't read them all out, but support to local residents, particularly young people with learning disabilities. And again, I'm clearly not saying that all care leavers have learning disabilities or people with learning disabilities are care leavers, because that's clearly not the case. But there probably is an overlap with all the support that's going into by that organisation that the council's grant funded. So I think although the grants aren't actually for care leavers specifically, I think there's quite a contribution that the grants programme is making. And sorry, councillor, I was so absorbed in looking up that information. Can you just remind me if Jane actually knows about the housing side?
I could comment on that if you want.
Yes, of course, please do.
Yeah, we don't have specifically for you, Councillor Taylor, the outcomes for 13K. Sorry, can you hear me okay?
Yes.
Yeah, sorry. The specifics of that, but we can definitely get that for you. What I would say with the housing team that's been excellent, that is very close to my heart in terms of consultation and actually engaging with young people is the focus groups they've been doing. So for those specific cases, we can let you know, but running the focus groups as they have been with Hampshire County Council and actually trying to get to the bottom of what are the issues that young people who are care leavers are experiencing, and how they are particularly doing it moving on from care and accessing housing support and advice. But they are, you know, it's a start of a sort of pilot, because obviously the most important people to hear it from are those care leavers themselves. So they are having regular meetings with local care leavers. There's a smallish group of young people, but Rachel said that it's been extremely revealing and informative, and actually they are looking at doing, they've got more sessions, and they're looking, some of the young people are doing audio diaries, and they are going to be hopefully producing, they're looking to potentially produce videos, etc., for other, to give guidance to other young people in the area. So it doesn't directly answer your question, but in terms of our interaction with young people, personally, from a, because I lead on the engagement and consultation area in the council, I just feel like it's something we really need to be sitting down with them to find out what they need. So that's a brilliant development. But we can come back to you on the other point if that's okay.
Yeah, that's absolutely fine. It is sort of idle curiosity in a way, because this is a subject that I'm also very keen and very interested in for young people, because they're often sort of quite forgotten. And similarly, if we have got any information about sort of grants, programs, and how that might support with the mental health issues, because I think young people are really struggling in that respect, and this group, I imagine, especially so, because they won't have large extended family support areas. I'd be really interested in that. Thank you.
No problem.
Thanks. Councillor Hawkes.
Thank you, Chair. And thank you for a very interesting paper. And I recall the conversation we had last year at CEP around this paper, which was very interesting. We had a presentation and I learned a lot. I appreciate that a lot of the support for care leavers rests with the county council. So you may not have this data, but I would be really interested in expanding a little bit on Councillor Taylor's question, specifically around, do we know how many care leavers in the borough area become homeless? Is that data that we get a hold of, and you know, a little bit of understanding about if there's anything more that we could be doing about that, if there are, would be really helpful. I can imagine that lots and lots of effort has gone into it. I'm not saying that we can solve a problem you haven't already solved, but it would be just helpful to understand the nature of that if it does happen. And also there's a lot of support going in to help with work. So do we know how successful we are in supporting our care leavers in the borough in accessing work? So I was struck with, for example, the traineeship course, which I think, if I've understood it correctly, is about helping people with the skills to get a job. So do we know yet how successful that is for our care leavers? And then finally, have we heard about the bid for the youth hub that's mentioned at the end, whether it was successful or not? Sorry, there's quite a lot in that one. Thank you.
David,
yeah, I mean, I think on the employment skills, it's difficult to separate out care leave, because obviously where initiatives are for young people, it's not. I mean, I'll come back to you, Councillor, but whether we'd be able to separate out the impact for care leavers as opposed to other people involved. So, but we will come back to you on that and come back to all members. But the youth hub, my understanding is that no, we haven't heard. I've certainly not heard anything in the last.
Not yet.
Days.
It seems a long time. That's all. October.
It's been chased up, I was advised today. So unfortunately.
Okay, thank you. And presumably the traineeship course is the same, that it's difficult to separate out data for care leavers similar to employment.
Yes, but I know that colleagues in the economic development team are in conversations with Hampshire County Council partners to try to be to break that down a bit more and have more conversations about that. So although the bulletin that is put together for the enterprise zone, the employment and skills enterprise zone, which is coordinated by the council, goes out to all the care leaver contacts we have and then sent on to care leavers as work opportunities. I know that Lisa Edwards is looking at how, because there's loads of training providers in the borough that are providing courses for free. Mm. They're actually saying that they want to reach out to groups that are potentially not being engaged at the moment, and so would be keen to provide courses. So there's conversations going on at the moment about how that could be sort of more proactively done. But
yeah,
there is specific.
I think, though, one of the issues, which I think is touched in this paper, is that the courses may be there, but a lot of care leavers, for a variety of reasons, will not access them.
Yeah.
So, it's not just about availability, it's about how to support them. And I did see here that Hampshire County Council are initiating, I can't remember what they called them now, but a new role that supports young people to pick up their lives and engage in things like employment and stuff, which sounds really useful.
Yeah, what they're talking about is tailoring, potentially if they had the market, they would tailor that course to care leavers specifically and market it to them. Yeah. What they're, eventually, ideally going to do.
A lot of this is similar to
individuals.
It's a different issue, I appreciate, but it's a similar kind of role because, what has been found is that people with mental health issues who have been out of work for a significant amount of time need employment support to get back into employment. Happens with people with learning disability as well. You can have an employment support worker that helps them get accustomed to work and then can disengage later. And I just wonder whether that kind of approach is what's being envisaged here in the county council's approach with the team that they're setting up. People just need a little bit of help. It may not need to be there for very long, but it's kind of like the family. And that's, I read here that the council has this kind of quasi-parental role, if you like, and that's what a parent would do, is they would help their children access employment and sustain it, because it's not easy, when you're going out to work for the first time. And it doesn't always work the first time, does it?
Yeah, definitely. And that's why the whole point of with the legislation and stuff, it says about, imagine if, would this on page 2, it's like, would this be good enough for my children? So you're right, it's the way that we should be approaching it.
Okay. Yeah. Thank you very much.
Thank you. Councillor Taylor, I see you've still got your hand up. Is that another question? Is there any more people who want to ask questions? Councillor Jones.
Thank you. Housing. I'll be honest, I want to ask a question. With care leavers, are we, the county and the borough, covering all housing needs for, in as much as where they're living? Have we got suitable accommodation for them, and how does it work? Because we know there's a housing shortage. Is anybody falling through the net, or when you actually leave care, do you automatically go at halfway house or wherever, which, as I understood it years ago, used to happen? Can someone explain what actually happens to these youngsters when they actually leave it, when they're leaving care, and how they're looked after and how they progress into housing in general, rather than a dormitory type living? I don't know where they are, and if I'm wrong, please say so, because I'm not aware.
David, do you want me to?
I think I'd say it's unfortunate we don't have a housing
director here
tonight. So but I'm sure, you know, Jane will, if anything that Jane will say, but if not, then again, we can inform members of kind of the housing journey, as they say.
Yeah, definitely. I mean, yeah, not the housing lead, but we definitely have a statutory duty to accommodate somebody who has care leaver status. So that is why there's such a close connection and a lot of work going on at the moment between county and our housing team to kind of facilitate that transition. Because yes, there's a statutory duty, but the work that Rachel's been talking us through when we have our regular meetings with Hampshire County Council colleagues is that they're going over above in terms of, as I said, you know, talking to the young people in the workshops, looking at things around the whole package of care as opposed to just here's a house. But what we can do, Councillor Jones, is we can ask Rachel if she's able to provide a sort of, like David said, like a journey of what they do exactly, and you know, then you get the outcome of. But that, you know, we definitely have a duty to do that anyway. But she can put some more meat on the bones.
I just sort of, so does any? Well, it might sound a stupid question, but does anybody fall through the net is what I'm really asking. If we've got all these things set up and obviously the county's aware who they've been looking after for a number of years, does anybody fall through the net, and what do we do to actually pick them up? Because if they are falling through the net through mental health issues or whatever,
yeah,
you know, how do we go about that?
One of the difficulties is some of the things that are provided are optional. As I said, there's statutory duty on the housing, but some of the support is really at that individual's discretion, which is why they have support people, which Councillor Vaughn mentioned, that to help them and encourage them to get the support that's out there. But that's something else we can also, because you're specifically talking about housing, Councillor Jones, or in sort of general pick-up of services, take-up of services.
Beg your pardon, I keep switching the blooming thing on. One fits in with the other to some extent. So if you've got people falling through the net, is it because they don't want to participate, or is it because there's other problems? Have we got the right accommodation for them as well? Going back years ago, it used to be that question about older people, you know, sheltered housing, things like that. That's what I'm interested in, that we actually, these people are being looked. I'm not saying they're not being looked after, but the ones that are hard to place, I would say, are we doing enough, or is there enough out there for them?
Yeah, I mean, that's something from a housing point of view we could check with Rachel, but I think one of the things I would say with our now sort of more regular partnership working with Hampshire County Council and BVA is that we are all the things that Basingstoke, us as a council, have on offer. We've now set up a web page which has been distributed to the local care leaver leads in Hampshire County Council. So we are kind of doing more push messages, because BVA is doing some interesting work as well. And like you said, it might be that people are just not aware of it, so it's just keeping people in the loop. But if they have any other particular barriers or conditions that might mean that they're not in the system, which, you know, can be quite common for many people, you know, we can have that conversation with Rachel about the housing aspect, but and also at the next meeting with Hampshire County Council, because we're having these quarterly meetings, just to see what they say about that as well, because obviously they're responsible for young people's mental health, so with you know, CAMHS.
Thank you. Are there any more questions? I don't see anybody, so I'll sum up. Basically, we've asked for further information on grants which are available to individuals, further statistical information, particularly those who become homeless. There's been questions raised regarding supervising / mentoring services for care leavers. We'd requested an update on how the housing process works, and requested information on how how support is given for vulnerable individuals who fall through the net.
Yeah.
Is there anything else I've missed off there? No, I don't see that. So the committee is invited to note that the actions taken by the Borough Council in 2020 to deliver on its role in relation to corporate parenting principles, particularly in relation to the care leavers, and actions that are underway to further enhance the support to care leavers in the Basingstoke and Dean. Views of the committee were sought on the work that is currently being undertaken and future plans, which I think we've covered. So I'd like to thank everybody for coming, Jane and David. Thanks for the update. And I'll move on to item 7 on the agenda. Thank you. So item 7, the ice rink update. So, well, first of all, we're still in a process where we're negotiating or where we're discussing financial issues. So I've asked to take this out of the public meeting, which we'll do in a little while. However, we do have 2 speakers, Sally Cashman and Heath Rhodes. So in a moment, I'll ask Sally to provide us with words. And ask officers to respond to any made. We do have an update, which basically I'd like to read out, which is public. So it's basically an update to CP 17th of March 2021 regarding the ice rink discussions. Discussions with Planet Ice have continued since the last update in January. Agreement has not been reached on how Planet Ice are going to fund the repairs required, and officers are going to discuss in a private session with members. 1, progress on discussions with Planet Ice, and 2, potential next steps. As a discussion with Planet Ice are of commercial and legal nature, the session will be held in private. So can I first ask Sally to speak for us? You've got 2 minutes, but I'm quite happy to let you speak a bit longer if you need it. So take your time, and I'll open it up to officers. Well, in fact, what I'll do is after Sally, I'll ask Heath Rhodes to speak. Same again, if 2 minutes, but I'm quite flexible on that. I'll open it up to officers to respond to any comments. And then I'll ask you to see if you've got any further questions. So Sally, can I ask you to speak?
Yes, can you hear me all right?
Yes, that's fine.
Right, I'd like to start by thanking members of the committee that have helped and supported the campaign to keep an ice rink in Basingstoke. I'd also like to thank the officers, especially Kate Dean and Ellie Cole, who have been really helpful and answered my questions when I've had questions. Unfortunately, in spite of everyone's efforts, we don't seem to be any further forward than we were 2 or 3 years ago. I think it is time that Basingstoke and Dean Borough Council accepted that their actions, whilst undoubtedly unintentional, make the council partially culpable for the state of the rink. Please could a statement be issued after this meeting to update the many people that are keen to know what the latest situation is regarding the ice rink before those people make a decision on how to vote in the forthcoming elections. Finally, I'd like to wish all the councillors standing at the elections good luck.
Thank you, Sally. You got me by surprise. You didn't even need a minute then.
No, I didn't know.
Okay. Can I just ask you to stay on the line and we'll listen to Heath now?
Will do.
Thank you. Heath? Do we have Heath?
Yeah, can you hear me?
We can hear you, yes. You got 2 minutes.
No problem. I'd just like to ask if the committee and or the chair can confirm that they are aware of the discussions between Basingstoke Council and Planet Ice on February the 2nd, where Planet Ice offered a £50,000 per annum as a return against the interest in capital investment on the contribution to the scope of works requested of Basingstoke Council for the repairs of the rink. Equally within that discussion, their Standard Securities also offered to extend the ice rink users clause by a further 20 years, which I believe currently is now matured. And as well as that, Planet Ice also previously offered and still stands a £750,000 contribution towards those repairs also. I'd just like to add in there was something at the start of the meeting about some delays with regards to waiting on information by Planet Ice. And I'd just like to add that we did meet with Kate and Jonathan on the 2nd of February, and we were sent the minutes of that virtual meeting on February the 8th. There was a correction in there, which was made by Basingstoke Council on the 18th of Feb. And as a result of that, we received a response from them on March the 3rd. If we'd been made aware that there was a requirement for this meeting to come back with some feedback, we would have done it. It would have only allowed us 10 working days, but we would have come back with some contribution.
Is that it, Keith?
Yeah, I mean, I'd also like to add that I'm a little bit disappointed that yet again, two major stakeholders in this, which are Planet Ice as the operator and the Basingstoke community, do find themselves in a situation where they're sort of being deprived of understanding what the communications are. And, you know, it would have been good to be involved.
Thank you. Can I just ask you to stay on the line, and I'm going to pass that over to officers. I know you asked me the question, but I'd like to keep my chairman impartial position impartial, if you like. So I'll hand over to officers.
Thanks, Chair. This will all be covered in the closed session.
Okay, I mean, obviously we're going into closed session because of it's a commercial issue, and it's something that councillors need to be updated on. We don't want it to go into private yet, so obviously for obvious reasons that's why it's become a closed session, or it will become a closed session. So I'm sure there'll be an update after that. Is there any officers who would like to ask any questions? Are there any councillors? And I'll hand it back to Sally. Do you want to add anything else? Sally, I can't hear you.
Yeah, sorry. I don't think so. It all depends on what is in the private session, which obviously I'm not going to be privy to. But hopefully something will come out of it, come out of the meeting fairly soon, and we can make progress.
Yes, I'm sure it will. I'm sure it will. Heath, do you want to add anything else, or any further questions?
Chairman?
Yes?
It's John Isaac.
Yes.
So, first of all, can I apologise for my somewhat alarming appearance? This isn't an election incident, but an appointment with Basingstoke Hospital, where I was very well looked after. But I just wanted to respond to Sally and acknowledge that, yes, of course, you and the ice rink supporters do need to know and do want and are entitled to have an update, and we will give an update after this meeting. But we're in the midst of sensitive discussions with Planet Ice, and that's why it's important we can update the committee in private this evening.
Heath, would you like to add anything further to that?
No, thank you, Paul. That's fine.
Right, thank you. Can I just ask as well, Sally? I mean, or state, Sally. I think probably in the last 2 years, it probably doesn't look like we're making progress, but you know, we've had several reports and several studies done. We've identified potential sites for a new ice rink. We have made progress. It may not feel like it to you at the moment, but you know, we have moved on this. So I'm sorry you feel like you do, but you know, we are trying. That's all I can say. So thanks for coming tonight anyway, and I'm now going to move it into a private session. So I need to advise the committee that in order to discuss the report, the meeting needs to move into a private session, and propose that the committee do that now. Can I ask for a seconder?
Catch that. Could you try again?
Sorry, can I ask? Yeah, thanks, Councillor Taylor. So I need to read the following. So to discuss confidential papers at a previously public meeting, I need to agree with members that the meeting is now become confidential by passing the following motion. That pursuant to section 100A(4) of the Local Government Act 1972, the public be excluded from the remainder of the meeting on the ground that the public interest in maintaining the exemption outweighs the public interest in disclosing it, and therefore the exempt information is likely to be disclosed as defined in appropriate paragraphs 3 of Schedule 12A of the Act. I need to explain that in order to discuss the papers, the webcast will be turned off, but turned back on once the discussion is over. Can I ask Democratic Services to remove any members, the press and/or public